My name is Dr. Owolewa, the current shadow representative for DC statehood, and now I'm running for DC Council at large.
All right, thank you so much. Uh, well, my first question then is going to be, uh, at-large DC council members often have a specific topic that what they want to have as legislative focus. Obviously, as the former shadow representative, not former, current, you have a specific focus that is more DC centric. What would be your focus as a DC at large?
Absolutely. Thank you for that question. I believe the best way to have our economy recover would be to get thousands of jobs pipelined to the district, rehiring our USAID workers, our former State Department workers, and our federal workforce. So my focus would be bringing industries like the international development scene from states like New York to the district to rehire the great people in DC looking for a better opportunity. That's an important question. Right now we are facing a $1 billion plus deficit based off of people losing their jobs and reduced taxes coming into our system. Now, while I believe in having folks pay their fair share, we also have to look at how DC is spending our money. I know I've gone to places, affluent places around the district, and I've heard conversations about people who are willing to pay more, but they're really concerned about how DC is spending money, right? We're talking about grants and contracts going to folks who aren't doing the right thing. We're talking about museums in Southeast DC getting $2 million, not being able to stay open for a year. So we have to look at what is important versus what is luxuries. So what is important? Healthcare. Making sure we're bringing industries to the district to rehire federal workers. Universal paid family leave. Making sure DC residents have good balance, especially folks who are struggling. Make sure we give them the support they need. In terms of ways we can save money, we have a lot of ways that the government could be a lot more efficient. Right now, there's agencies in the government that aren't communicating with each other. When I had the expungement clinic trying to help returning citizens get their lives back in order, MORCA, the Office of Returning Citizens, wasn't always communicating with the Department of Employment Services, wasn't always conversing with Department of Health. And when we take people out of their silos and communicate with each other, then we have fewer duplicitous actions, and that can help save us money. Also, our healthcare. Right now, hospitals are not communicating. So if one person goes from one hospital to another, oftentimes they're getting the same treatment twice over, but the insurance only pays once. That's costing us millions of dollars. So finding ways for us to be efficient helps us afford the things that we want to do that we may not be able to pay for right now. And that's how I'm trying to focus as hopefully the next council member. As we know, as pharmacists, you don't treat the symptom, you treat the body. And right now we have a government that treats the symptoms, and we're finding ways and ways and ways to spend more and more money and not being able to produce the results that DC deserves.
Yeah.
I completely understand your question. With nine candidates, it's hard to stand out. So some people may differ in certain areas, but I believe where I stand out is not only my track record being a former ANC Commissioner Ward 8, now U.S. Representative fight for DC statehood, but also how hard we fight, right? So every candidate has said they don't want ICE in DC. We're going a step beyond. We're challenging Clark Construction, one of our strongest business partners, to divest themselves from an ICE project coming in Ward 8. These are the type of things that most candidates may not be willing to do because maybe they have corporate backing or maybe they're seeking endorsement from the construction communities. We're unafraid. We said no to all corporate organizations, not because they didn't want to be involved, because we said no. We wanted to make sure that our voice represents the thousands of phone calls that we had, the thousands of days we've been in office, and making sure we're not turning our back on working people and district residents who deserve better. So we may say similar things, but I believe that our track record speaks for itself. We've gone all throughout this district, whether it's from the more affluent areas to the areas that need the most help, and we have put in the work. We've gone to classrooms, getting kids interested in science careers by 12 years of science enrichment experiences. We've gone to every community, done healthcare pop-ups when we didn't have to, and we've done business workshops to teach business owners and entrepreneurs how to get grants, how to get contracts, how to get certifications so they can scale up with the government's assistance. That's unseen of in most challengers in this race. So our words may be the same, but our track record certainly isn't. And that's part of the reason why we have 25 plus endorsements, which leads this campaign and race combined. That's why we raise the most. That's why we have the most on hand. And we said no to corporate backers because we believe in having candidates that answer simple questions with simple answers, not so complicated question answers that you forget what question you even asked. And DC residents deserve transparency. They deserve honesty. They deserve someone who's unafraid of being wrong. Look, I have a 51 for OEA program. It's a coalition of experts because I can't get everything right. If this is a healthcare conversation, this conversation can last for 4 hours. But when it comes to housing, economic development, when it comes to youth programs, I lean on other people to help me get this right. It's not about, being the loudest voice in the room. It's about making sure that our legislation, our oversight, and our budget reflects the needs of DC residents.